welcome back to another episode of Thinking That Matters. I'm Elizabeth Mahusai, your show host, and we have episode 2 in our series of the things you were never told about being in your 50s, specifically women edition. So I am here with 2 guests, of course, Trish, who helped me come up with the whole idea of the series, and today we have Dr. Oni back on the show as well. I got to interview her earlier. So Trish, kick us off. Tell us a little bit about who you are, what you do, and where you are in the journey of the 50s.
Yes, I'm Trish Littlejohn, and I own a construction company with my husband, Trimark Home Construction. So, and I'm 56. I'll be 57 this year. So my husband and I kind of joke because he was born in 57. I was born in 69, and he'll be 69 this year.
Aww.
So we kind of laugh about our age a little bit, but
that's fun.
So yeah, kind of a cool tidbit, I guess.
Yes. Dr. Oni?
All right, and I am Dr. Oni. I'm a board-certified family and obesity medicine physician. I'm also actually recently certified by the Menopause Society, and I literally just turned 50. So I am just making that grand entrance into the 5th floor.
I love it. The 5th floor. Yes. The 5th floor. When you said that you were just recently certified, tell me about that.
Okay, so the Menopause Society was founded because there's a lot of new science and stuff that we really didn't know about menopause. I feel like women's health a lot kind of got sidelined, especially in the early 2000s. In the early 2000s and, in the 90s. And there were so many things that women just kind of suffer through without having any real, information or knowledge. And then our moms, somehow this was kind of almost like shrouded in secrecy. Nobody really told. I don't remember my mom ever telling me, oh, I'm having a hot flash, or, oh, this is, how life in the hereafter is. So anyway, to become a Menopause Society certified practitioner, you have to do some courses and take a board exam.
So Menopause Society. Mm-hmm. Trish, did you know that we were part of a special society?
No.
I mean...
Test is hard.
The test is very hard. Will we pass? Yeah, this is the question. Yeah. And how many people will we drug along in the process of trying to pass it? Okay.
It's interesting because actually this, to become a Menopause Society certified practitioner, you'd have to be either like a physician or a nurse practitioner or a PA. And it, encompasses women or physicians from every specialty, because even the obstetricians and the gynecologists, who you would think would be the ones to know all about menopause, also found that they also needed extra education. So you have, family doctors, internal medicine physicians, you have obstetricians and gynecologists as well, wanting to get that extra education and become certified.
Wow. Okay. So, and that's one of the reasons why Trish and I felt strongly that we wanted to get a doctor on one of the episodes because of such a lack of education. We were talking about that in the first episode in this series about how it has impacted us, the hot flashes. What else did we talk about, Trish, in terms of some of the impact?
Brain fog sometimes. And you're like, what? I don't know. Sometimes you're like,
what causes the brain fog? I want to know.
I call that meno brain.
Yeah.
Wait, is that about men?
No, menopause brain. I say meno
That was a
brain,
joke. It was a joke. It was a joke. Yeah. Oh yeah, it was a joke.
Fair, everything that has to do with us has men in it somehow. So it's their fault. We'll blame them for the whole thing.
Fred will be like, don't pin this on me.
But basically, what this really is all about is the main player here is our estrogen levels. And honestly, we don't really kind of think about estrogen beyond the concept of, pregnancy and menstrual cycles. Yeah. So as women or as little girls, we're born with all the eggs that we're going to have when we're born. And, as you start to grow and you mature, and then the ovaries start to become more mature and start to release an egg every month, and there you get that monthly cycle, right? So most of the time when we're thinking of estrogen, we're only thinking of it in terms of periods and what, its impact on periods and pregnancy and conception. But the reality is estrogen is such a big player in our cognition, centers in the brain and our bones and our joints and, it's almost indicted in almost every body system, I would say. And so as we start to get older, I like to describe it as our ovaries are kind of shriveling. They're no longer as, we're kind of get to that age.
They're not as voluptuous as they once were.
Yes, they're not
as sexy as they are.
That's right.
They're not supple, and so those estrogen levels start to dwindle, and then that's what happens is suddenly the lack of estrogen. Now we start to get all these changes, right? So cognition, there's all these issues with memory, and you kind of walk into a room and you're kind of like, why did I come in here?
Oh my word!
That
Where's my phone?
where's
and
my
you're holding it,
and you're holding it, or where are my glasses?
That is the worst. Where is my phone? And it is
and it's an instant panic.
Yeah.
Like, did I just leave it? And it's right in my hand,
here.
or
Yeah. But again, everywhere, your skin, so it's just such a big player. And for the longest time, we didn't, we weren't. It wasn't that it wasn't known. But then it's like, what do you do then? There just really wasn't enough education or information
around it.
Yeah.
So I want to go back. So Trish, I want you to speak to this because something that Dr. Oni said really caught my attention, which is that our parents, our moms, like I don't recall, I have two moms. I have a mother and I have a stepmom because both my parents remarried when I was young. So I grew up with two ultimately, in different marriages, but it's not something they really talked about. Did yours, Trish? I mean,
well, my mom had a hysterectomy early in life, so a lot of people say, "Oh, well, how was your mom? What did your mom go through?"
She do? Yeah.
So now at my time in life, they're like, "Well, how was your mom?" Or you can look it back, but she had that, and my mom was always hot. Like she's always been hot. Like she doesn't like to, she's not an outside person. She's not things I like to do all the time. So I haven't really been able to coordinate the way I feel with her so much. Yeah. But I guess the question I have too is, let's say I don't have any children physically. I have a stepdaughter, which I love to death, but I don't have any children of my own. So I know other women that don't have kids either. So do you find their menopause is different than, like Elizabeth has two boys?
Yeah,
so is that a lot different for them, you think, than people like... Then my mom had a hysterectomy early in life, but you think it's different for me because I've never had children, or?
I wouldn't say so. So in
I know
terms
there's
of
studies for it.
Not to my knowledge, but so in terms of your mom, the question then would be, did she have a complete hysterectomy or did she have a partial, right? Because, if she had a complete, then they took the ovaries, which again, and that's such a bummer because if there wasn't like a cancer reason for taking the ovaries, then what essentially happened was that at that age, we kind of threw her into premature menopause, right? Which then makes it even longer,
later 30s. I think she had. I don't know if she was, I guess, sick or something. Maybe, obviously.
So that must have been a reason for it. But then it then prolongs her own. Because a typical 30-year-old woman is not typically in menopause yet.
No.
But I wouldn't say that there would be any difference between someone who's had a child or who hasn't had a child. Regardless, your ovaries have been releasing an egg every month. Yeah. Now they're shriveled up and they're dry. Our estrogen levels are kind of dipping. I don't know that there will be any correlation between.
I know this is going to be a little bit of a squirrel, but my brain, like when you were talking about we're born with the number of eggs that we're going to have for our entire life, and literally my science brain starts going, okay, so that's 12 cycles in a year, and you stop having a cycle at like, let's say 50, so maybe from 15 to, I was late starting mine, so I didn't even start until I was 15, and there are girls starting at 10 now. Their cycle's beginning like at 10.
Even 9.
Which is that, I don't know, to me, that's mind blowing to be that young. Yeah. But I don't know, maybe because I was a late starter. I don't know. But anyway, my science brain was like, that's a lot of eggs in there.
Mm-hmm. Yeah, they are a lot of eggs. Actually in the millions, if I'm not mistaken. But they're a lot of eggs.
Okay. Well, that's good to know. I didn't realize there were that many. I started thinking.
And that's an interesting point you brought up with younger, girls starting younger and younger now. Like for me, I also was a late bloomer. I don't think I probably started having periods about 14 or something like that.
I was 15 because I remember thinking, I'm so old.
I'm not normal, But these days, honestly, I'm seeing 9 and we're kind of wondering, well, what is going on? Does it have something to do with our food? Is it,
I've heard that. Yeah. Like the hormones and, all of that. Well,
they even talk about girls developing more now, too, at younger ages. Much younger. Even if you're younger, but you're looking at a girl and you're like, oh, she's only in, 5th grade. She looks like she's in 7th or 8th grade or in high school already. So not always what they're wearing necessarily, but just the way they look in general.
Because you can see breast buds, you can see
you can see it all.
So thinking about, because, my mother, she she had a hysterectomy early as well. I want to say she was in her early 30s. I don't know if it was full or partial, but let's go with full because it was medically necessary. All right. I know she was on hormone replacement therapy for a long time.
Great.
So talk to us about hormone replacement therapy, because I hear a lot of things around that. So I would love to know from a medical perspective, the benefits, maybe the challenges. Talk to us a little bit about that.
All right, so that's actually great to be fair, it's great that now the conversations are ongoing, because I think for the longest time, nobody was talking about it. Women were kind of suffering in silence. Doctors didn't know enough of what to do because it was just thought that, oh gosh, to replace estrogen, because estrogen on its own, if you just think of the molecule itself, especially when you take like oral estrogen, where it then goes all over your body. It's like, oh my God, if you've ever had a risk of family history of blood clots or any history of cancer, now by taking that, we're increasing your risk for cancer and blood clots. So it was just like, oh my God, we can't do it. We can't touch it. No, and so women were just like, kind of left to sort of suffer, with nothing.
Wow.
But now, that more and more studies have gone on, and I don't want to go back and talk about that old women's health study that was done initially, where it just found that there were certain nuances that were missing. And that's why nuance and context is always important. So now, basically what you're trying to do, essentially, because it kind of makes sense, it's a no-brainer. If all these problems are being caused because of a lack of estrogen, well, then just replace the estrogen, and then women will feel better. Again, there is still context and nuance that's important, because certain things come into play. Do you still have a uterus, or do you no longer have a uterus? Because if you do have a uterus and you're taking estrogen, basically what's happening is you're just putting down that lining in the uterus, which then increases your risk for what we call an endometrial cancer.
Okay.
Well, so then we have to give you progesterone with that to make sure that that doesn't happen. So again, each woman is different. The conversations need to be had with your physician to figure out what's the best way, and not also what's the best way, but what's the best method, right? Because now we have the gels, we have the patches, we have the cream. So you're not actually taking a systemic estrogen that's just kind of,
bathing your body in it.
Yes, going throughout the whole system, and then increasing risk of those things that they were afraid of in the past.
Wow. Okay, so I want to bring something else in, because I know that a lot of times when younger gals, whether they have super heavy periods, cycles, they will often be prescribed birth control to try to help control that. What studies have there been, or correlations between early use of birth control and any impact that it has on estrogen levels, or even what that looks like later in life from a hormone level?
I haven't really looked at the most recent literature to try to put that together, but as far as to the best of my knowledge, I don't think that it will make any difference whether you were on the pill or I wasn't on the pill. Regardless, we get to a certain point where it's just not. To be fair, though, let me kind of backtrack on that statement. Some practitioners would say, okay, well, if you started to not feel right, why don't we put you on the pill and give you a little itty bitty dose of estrogen and see if that will help make symptoms better. But again, that's also because we were not, there was not enough information or knowledge about what to do, when a woman comes to you having these symptoms. And so it ended up with us just throwing the kitchen sink, right? So if a woman comes and all of a sudden she's anxious and she's no one was making the correlation that, oh, is this because of menopause or perimenopausal symptoms? And we'd be like, oh, well, here's a pill for your anxiety. Here's a pill for you. And I have to say, to my shame, that I have also done that in the past, because it's like you're looking at this woman who's suffering and telling you, all of a sudden I have anxiety that I never had before. Nothing else has changed in my life. There's no stressful circumstances. There's nothing situational to point to anxiety. But you're kind of like, okay.
But it's a real thing. Have you dealt with it?
Yes.
Because I would not consider myself an anxious person, but when I had a partial hysterectomy at 41, I had to think about how old I was. He wanted to take my ovaries. I was like, no. Because I had a lot of endometriosis and all that. I was if there's any way for you just to clean them off and let me keep them, because I didn't want to go full on menopause at that point. But all that to say, by the time I was cresting into my 50s, I was dealing with more what I would call anxiety. I could feel it, the tightening in the chest, this kind of overwhelming sense of why am I, like, I would start, because I know to breathe through it, because there's no contextual clues, right?
Yes.
To think I should be anxious, yet I feel anxious. So I know the brain is very powerful. So I know how to talk myself out of it or breathe my way through it. And, I'm like, and Fred will be like, are you okay? I'm like, oh, just over here dealing with some anxiety, right? I mean, it's the wildest. How about for you, Trish? What's that been like?
Oh, yeah, no, it does happen. Yeah. But I think that's where, I think in general, women are always, it's just, they're anxious. There's always something else. It just can't just be menopause.
Yes.
It has to have, you're depressed, you're stressed. Why? Oh, because I have 2 jobs and I have 4 kids at home I have to feed, like all these other things. I don't have those things, but so women are overlooked, and nationally, this is Heart Month, and I had open heart, and so I don't get to, and I have a blood disorder, so I cannot take anything for the menopause. I was just with my hematologist last week, and she was like, you can. I said, I know, and but, heart attacks happen with women because of this exact thing.
Yes.
But their symptoms are totally different. They could have jaw pain, and that's a heart attack.
Yes,
they have
really?
shoulder blade
Yes,
pain,
ma'am.
and they can have a heart attack. But they go in, or they talk to the doctor, and they're like, but I'm kind of anxious. I'm not feeling good. I've been having, and it's just a pill. And it doesn't matter if it's a man or a woman doctor. Women are just overlooked in general. And that's why the first Friday in February, I make a big deal, because it's National Wear, Red for women with heart disease, because it is a big deal. And women are, they think we multitask a lot.
But to be fair, we do.
We do.
And the truth is, it's always been, you're in menopause. And I think women don't want to, even the movie stars, you never hear them come out and talk about, they'll come out and tell you they had, facelift or something, but they don't say, oh, I'm in menopause, and how it's affecting them, I don't think. So you don't really hear about it. I don't even think our girls, my niece is 17, and I don't think, it's a little early to talk to her about it, but not really.
So what would we say?
And it was interesting. Sorry, Trish.
No, it's all right.
It was interesting too when you use the word hysterical. It's like, aha, that's sort of the same way when they finally gave a name to premenstrual syndrome or premenstrual dysphoric disorder, because there's some people, young girls and women who get extra moody and irritable around cycle time. And so at first it's like, oh, these women are hysterical, it's not. But then after a while, when the numbers start to become so many, it's like, okay, all these women can't be crazy. There has to be something.
There's some other.
Exactly. And then finally, like, okay, well, let's call it this.
It's always
now
something.
we can name it and call it something.
Yeah, like,
right?
actually we have something we're going through.
Yeah. There's this running joke that if there were many things that women experience, if men were experiencing it, they would have found a name for it a long time ago, or on some kind of treatment for it.
And they would have demanded treatment. So I want to go to that though. Something that you were talking about, that like movie stars aren't talking about it, and we talked about our own parents weren't doing a lot of talking about it. What I would love to hear from both of you. What do you believe is this? Would we use the word stigma, or?
I think it defines our age.
Maybe.
If you say it, who wants to be, who wants to say, because I feel like you,
60, huh?
55, you're like, you're halfway through your life, and then you're like, but now I got all this other stuff, and I can't get this weight off. Like, you have all these things, and yet you don't want to live in, woe is me, I'm so, sad, because it's not. It's like, it is what it is, but I don't see J-Lo on anything saying, hey, I'm in menopause. And I'm sure her mood swings are no different than the rest of the women. And I know what age she is, because I'm the same age she is. So, but it's just like, but she's a big movie star. So it's just like, but none of them have a podcast talking about menopause or how they feel about this or that. And so I think it's like, nobody wants to define their age. Nobody wants to
What do you think, Dr.
They're constantly doing
I'm
facelifts and whatever else. Obviously, I missed the boat on that one.
Vanity metrics. Well, I'm not sure why, honestly. I know for me, maybe it was a little bit of cultural, there's just some things we didn't talk about. I don't know if on the show the other day I had mentioned, like my husband, for example, his dad obviously had to have had something, but the question was, did he even know, or was it even being treated? But he just passed away. And pretty young too. Yeah. And so I remember when my husband had gone to the doctor and they were asking, what's your family history? And then he paused and actually thought and said, I don't know. So I don't know if it's maybe parents didn't want to worry us about it, or they didn't think it was relevant, or they didn't understand as well that sometimes these things matter, because when you can find a pattern, if it runs in the family, then the doctor knows, oh, okay, you're at higher risk, exactly, aneurysms, hypertension, heart attacks, because if you have a family history of someone who's had it, well, automatically your risk also goes up, right? Even though we all start at the same on the same level playing field, but if you have a family history, well, now you've climbed up one step up the ladder. But maybe, I don't know, maybe parents didn't understand the importance. But also in terms of the movie stars, I don't know. I do know Mel Robbins is pretty big on things like this.
She's willing to talk about it.
She's really come around. I like to watch her too. and read her book So
wow, that's I'm just thinking about, were our parents trying to protect us, or it's interesting because they're the older generation. I've been doing a lot of training on the different generations, and baby boomers and silents, as they're called, the older, they were just head down doing the thing, right? It's more younger generations that are talking about how we feel and how it's affecting us, and, all of that. So that could be part of it too.
To all kinds of things. And maybe how you could prepare. I think knowledge is power in anything, right? So if there was a way, let's say you rewind to your 30 and you're in your 30s, and you'll go, okay, when you hit 50 or get close to 50, you need to start preparing yourself for bone density. So start now with this. I think those are the things that would be nice that was out there. A little bit more open for young gals, even in college or something, to say, look, later in life, you're going to have some things. Start preparing now for it. Because I do think kids are a little bit savvier about things than maybe we were, because it wasn't so talked about.
They are, so much so that I read an article that there is great concern among dermatology doctors that young girls like 12, 13, 14, they're using skincare regimens that we use in our 50s. That is meant for anti-aging and dealing with where our skin is and the impact that it's going to have on their young, not fully developed skin. So I think
that's a good point.
I think we are trying to find a good management between that, so that because right now, it's interesting that you say knowledge is power. And I think about when we were 15, right? The only reason that I knew that I was late to the party and a cycle starting is just because I had friends who were already. Now a 15-year-old could Google search what percentage of people have blah, blah, blah. The amount of knowledge that can come, or WebMD. I know you have to hear about this where I had
already diagnosed themselves.
It's true. Or they take a report from their doctor and they're plugging it in, and next thing you know, I'm dying because there's not as much context as we would need. So if you had to, as a doctor, even if you gave us top 3, 4, I think, no more than 5, but what would be important for women who are in their 40s, still having a cycle, right? So we're taking out the hysterectomy, partial or full. What would be important things for them to be on the lookout for?
So one thing, actually, in fact, interesting that you kind of pegged it at 40, because I feel like 30 even is a good age. Right. So I think one of the things, especially you mentioned bone density, Trish, which is also very important. One of the things we weren't really told, just to drink your milk, but nobody said why. The reality is that our bones hit their peak strength at 30. And it's almost like you're cresting a hill, and then you get, 30, and then from 30, it's going to start this little downward slide. And that's just inevitable for everyone. And so the idea was we should have been told, okay, really build your bones up really solid by 30, so that even when you start that downward spot, you're starting from a really solid point. Okay. But then again, I always say, well, it's never too late. Now we know, so what can we do? So things like strength training, very important. Actually, I was doing, I was discussing with somebody yesterday about, 90s diet culture and all the things we were told and we were taught that ended up not being correct. And again, this is not a science bashing experiment. The reality is science evolves, and as
we get more information.
As we know better, then we do better, right? So all the things we were told in the 90s, and fat is bad and carbs are the enemy and all that stuff. But realistically, starting to really do a lot of strength training, which is something that one should just incorporate into, your exercise routine, your regimen. It doesn't have to be anything fancy. Anything that involves your own body weight, resistance bands, things you can even do yourself at home, free weights, just a couple of times a week. It's really good. And then just trying to be in the best health that you can be in, watching kind of like diet, lifestyle. Again, you talked about the hypervigilance and the hyper-awareness now, and there is a little bit of danger to that because you see all the people self-diagnosing on TikTok, and it's like putting all these symptoms together in ChatGPT, but without the nuance and without the context, right? Because what's anxiety for me that's caused by my menopause might actually be something different for you. It might be a thyroid problem for you, or it might be you actually have anxiety, So again, all those little nuances are missing. So it's good. I don't actually mind the curiosity on the part of my patients because, then you can, come with a little bit of curiosity and say, okay, but this is what I saw and this is what I heard. What do you think? As opposed to, oh my God, now I'm dying and I'm freaking out about every little thing. I think the preponderance of knowledge has also caused a lot of health anxiety.
Health anxiety. That's a great phrase. That's a really great phrase. Now, Trish, you had open heart surgery. What led to the open heart surgery?
Well, I had an aneurysm. They found by just a bug bite that got, it was kind of a crazy thing, and I had anaphylactic shock from it.
Wow.
And then they found it, so I'd always had it. And my father has the aneurysms on his side, but my mom has blood disorder on her side. So I got both of those. So the blood was a factor. And then I have a mechanical valve in my heart now. So I never had children, but the doctor, when I first met him, he goes, well, I know you don't have any kids. And I said, well, how do you know that? And he said, because you would have died if you would have had a child. He goes, because you wouldn't have enough oxygen for both. But those are the tests that, like, I had knee replacement, all these things. I'm like, they didn't see the aneurysm then, but aneurysms are starting to come around so much more now. So people are having them and they find out about them earlier on so they can watch. So the more I would have worked out, which I did play college ball and I coached all that. So the more I worked out, the bigger that aneurysm got on the top of my heart and not knowing that, right? So everyone's like, well, work out, run, do all these things. Well, actually it made it worse for me. Wow. So the aneurysm was like a balloon, an animal balloon. And you know how they're really hard to blow up?
Yeah.
So the doctor said, well, that's what yours is like. But by the time they caught it, it was almost 5. And it needed to be 5 to do the open heart. So on my 10-year wedding anniversary, that's what I had. But unfortunately, the blood almost took my life because even though the genetic testing I had done, they didn't do anything. So I still blame genetics on some aspects of our life. Or, American Heart, I was at an event one day, and it's not recently, and they didn't talk about genetics. I'm like, but it's genetic. Like sometimes it is about genetics. Sometimes some of us women have the genetic part. I feel sorry for sometimes when people maybe don't know their parents because they were adopted.
Right.
Well, so then they wouldn't have that. They wouldn't have that, advantage to know like, hey, what happened? But at least I did know my parents. I'm like, oh, my mom has diabetes. I go, please don't give me that one too. I like chocolate.
Not one more thing, please.
Yeah, please. And now I'm a little bit more, I guess, aware of stuff.
Yes.
Paying attention. And I think until it does happen to you, probably menopause, same thing. Until it does happen to you, you kind of hear it, but you didn't listen.
Oh, but it's so true. I remember I was, I think I was 40, if I'm not mistaken, and I was at an event, and a dear friend who's, I think she's probably 10 to 15 years older, somewhere in that range. So she would have been, let's say, between 50 and 55. And she was making a joke from the podium, because it was a large crowd, there were about 1,000 people in the room, about how she just was forewarning us that if a hot flash came on, that her first instinct is to go to the bathroom, strip naked, and lay on the cold marble floor. And I remember sitting there going, well, that sounds, I think you're embellishing a little, right? Until that was me. And I started having these, and I don't get the sweats, but when I first was having them terribly, like throughout the day, all of that. And I was like, this, to your point, Trish, this is what she was talking about. And I was over there thinking, that surely that's like an exaggeration.
Yeah. So even if we do educate at younger ages, they still are like, oh, you're so old.
Well, it's
like,
that, you know, I'm young, I can do anything.
It's never going to happen to me.
I'm invincible.
Exactly. I'm invincible. So I think it's still good to have a certain level of education. I'm also hearing from what both of you said, the importance of educating our children, for those of you listening and watching that have children, on family history.
Yes.
Right. To better understand, even if you won't need to know it until later, but you know it.
Yes.
Because it does make a difference.
It does make a difference.
Where that is concerned. So I think that's an important piece on that. Now, something else that you said that caught my attention as well about the skin. I literally was just saying to Fred the other day, I'm like, my legs, the skin on my legs, I'm looking like this older woman. And he's like, what are you talking about? You know? So what is it about estrogen that impacts skin elasticity and in effect? Because you know right now the big craze is get on collagen. You need to have a collagen drink, collagen. Please set the record straight, Dr.
Oh
Oni.
my God, there is just so much. And actually, even on that, the jury's out because, you know, if you talk to an actual pharmacist, for my education about things like that, I actually like pharmacists because yes, as physicians, we do study pharmacology, but you can't compare
to someone who has the degree
who actually studied pharmacy. And so if you talk to a reputable pharmacist, they'll tell you this whole collagen thing is just marketing, you know. Get your stuff and your supplementation from your food. A lot of these collagen supplements that we're selling, they're just, you know, you buy them, you eat, it goes through your liver first pass. Most of it is already gone anyway in the gut. And so you're just making somebody else rich by buying all these supplements that you don't necessarily really need to. But then you'd also see some physicians who are also marketing collagen. So it's like, okay, I can understand why you know, a lot
confusion.
of times there's a lot of confusion out there, and it's hard to kind of separate who's just unscrupulously trying to sell you something versus who's actually trying to tell you what is, you know. I think one big thing is that we also have to embrace is that there's nothing wrong with aging. It's a rite of passage. I think that's the first, you know, it's a very big, I remember when my youngest son he always had a problem every time I had a birthday. Because I think for him, in his mind, he had some friends who'd lost their mom. And so for him, every year that I got older, it's like, you're getting closer to that age where maybe mom is not going to be here anymore one day. And he would always say, oh, I don't want to hear it. Like, oh, you're turning 40. I don't want to hear it. And one day my husband said, well, if you want to stick around here, you kind of have to get older. Yeah. The only way to freeze your age is if you drop dead right now. So embrace it, right? Exactly. I think there's, and I'm not saying there's anything wrong with trying to enhance our looks or, you know, just feel better in our own skin. But there also has to be that fine balance between aging.
Okay, so let's talk about that, because one of the things that I do say, and that when I find myself wanting to hyper-focus on like how we change as we age, you know, I'll look at Fred and say, just remind me, it's about aging gracefully, right? So I like your phrase, it's a rite of passage. So let's explore that a little bit, right? Okay. Because I think people watching and listening, this is a real struggle. And just speaking really just from a sense of observation, so please hear my heart, not from a sense of judgment. I really want us to have conversation around this, because there is such a struggle and there's so many anti-aging, whether it's fillers, Botox, like all of the collagen, all of these things. And there are some people where I start going, I don't even recognize you anymore. Like you look so different because you've had so much stuff done, or you're ongoing getting so much stuff. I don't know. Let's speak to that. I'm genuinely open to hear. Again, it's not about judging. It's about, I know we're trying to reconcile that we're aging and we're not going to look the way we did 20 years ago, no matter how hard we try.
No matter how hard
we will not look the way we looked 20 years ago. I don't know. What do you all think?
Yeah. I think there has to be some what I call just healthy expectation, right? And so first of all, I'm always like very cautious. I always say, beware of any doctor who promises you any and everything. Because they're not going to be able to deliver. You have to be able to set realistic expectations, with your patients. And so even me as a person, I have to have these realistic expectations. What do I expect my body to do right now? While I will do my best to optimize its strength and efficacy, because again, we're living longer these days. So we also want to live well, right? We don't want to be, 60, 70 and be bedridden because, or someone will say, I don't want to be the sickest person in the nursing home, right? We are living longer, so we want to live healthier, right? So we can do things that we can do to enhance our, I don't like to use the word longevity, but just to enhance our health, right? So that we are in the best health for as long as we can. I want to be able to carry my grandkids. I want to be able to go running with them and catch a ball and do things like that.
Yes.
But then also just reconcile the fact that I don't think I ever will be the weight I was when I was 16.
Yes.
Right? That is the reality. My metabolism is different now. Things are different now. There's, as you go through life, all these different phases and stages, each comes with its own. And so I think it's a little bit unrealistic to want to over enhance to the point of becoming unrecognizable, kind of like you mentioned. But again, maybe some people just have a harder time with
that. Trish, what are you
some
thinking?
People might do stuff too early and then as they're getting older. I mean, today we're good, but you could have been in a car accident, you could have open heart surgery, and now your body doesn't look the same as it used to be. That personally happened here, but we don't know. Like today we are what we are. Does that make sense? No matter what you do. So I think sometimes we have to live with where we're at, and that's maybe where reading the right books, what you think matters and how you see yourself. Elizabeth had this a little thing once that she had with her other book, one of her other books, and I have it on my mirror. Yeah. And it reminds me sometimes just to be present in the moment and just to be happy, because we all have that moment. I do think menopause can make you have some hormonal depression issue, or I don't know, it just feels sad. Maybe just sad. Like you're thinking, why am I sad? Like what? But you are kind of feeling that. Like we even talked about girlfriends as you get older. But I think it's just because you're just in a different stage in your life maybe, and they're not there yet. I'm not sure, but I think technology and society and all this makes it hard for women as a whole. You have to be this, and this. Men get away with that again. And it's not a man bashing thing. It's just, I feel like men can gain weight. It's no big deal. They don't blame it on menopause. They don't have it, but I think they do. But I
Fred
think
calls it menopause.
Yeah, they have their own issues too.
So it's like, I feel like sometimes you're not accepted in society as well if you're not doing some things.
That's interesting though that you say the technology piece too. Two things where my mind goes with that is, our parents, when they were our age, it was in the early, I mean, I remember my mother being she was 40 and she had the brick cell phone box, right? Like where you carry it to and from the car and you plug it in to give it power. And because she worked for the telephone company. But I mean, they weren't searching the internet. They weren't seeing all of this, advertising for Botox and fillers and facelifts and boob lifts and butt lifts and, all of these different things. So there wasn't as much maybe as a comparison trap.
I agree.
There was definitely comparison,
there
obviously.
Selfie taking.
But there was not any selfie taking.
And then you're like, oh, they look so good. And then people go, Trish, there was a filter on that. I go, I need that on my phone. I don't have that.
I think that's all we saw in the movie stars on television. And that just seemed unattainable. Like, that's for the movie stars or it's for the rich or something.
Think about even that. I mean, Marilyn Monroe was not a 0. Or a 2 for that matter.
She was like a 12 or something, wasn't she?
I like the fact that you brought that up because, again, this is part of what I was talking about yesterday with the 90s diet culture. I've just seen how, curvy used to be it. And then all of a sudden skinny became it. And then, and there's just been this. And now I kind of fear we're getting back to skinny.
Someone said to me last week, I was at the church, she said, I'm really concerned that we're in this skinny girl culture because GLP-1s and things like that. And I know we don't have time to get into GLP-1s. We'll get you back on the show, Dr. Oni, about GLP-1s because there's a lot around, because I know there are some that are probably very good, and awesome. But I think you're right. We have, I guess, what was it? And I don't know if it was in the 90s or even before, the diet pills that people were taking.
Dexatrim.
Oh my word. I've not heard that word in like
I was a comedian.
decades.
I just saw this comedian. She was laughing and talking about how she took it when she was a kid.
So I think you're right. It is, we are back versus the mindset of how can we have better health for as long as we possibly, because clearly heavy weightlifting, if you're eating properly, you might lose weight doing that. Your body's going to look differently. So I think there is something to be said for the fact that we have so much access to visual stimulation, and how does that impact the brain and what people believe is necessary?
It does impact. It does. I grew up in Nigeria, and for us back then, it used to be a curvy woman was evidence that she was well taken care of by her husband. Right? And then all of a sudden, when we started getting this influx of like Western media and stuff like that, and you would see the girls, the models on the runway, and all of a sudden everybody wanted to be skinny, right? But then even that became dangerous because they were almost like anorexic even, like this is not good. And even that, industry had to revisit that and say, okay, we got to put the brakes on this. But now I slowly see us getting back there. And even though, yes, I'll just mention the GLP-1s briefly, which are very, very good. And really for some people, it's literally a matter of life and death. But I fear that it has become, because all you need to do is go on the Facebook groups and you see people asking, who's your plug for GLP-1? I'm like, oh my God, this is not how this is meant to be used.
Right. Yeah. It's ensuring that there's medical oversight. And to your point, I was thinking about the two words that you used multiple times, nuance and context.
Yes.
Right? And her nuance and context with open heart surgery and aneurysm and blood disorder, et cetera, my nuance and context based on, my family's history and background, it is, that's why the medical oversight is important where that is concerned.
Yes.
All right. So let me do this because we need to wrap this up because I know we could keep going. I'm loving this. I'm already excited about, the next one that we will do in the series. I'm going to ask each of you, and let's all three share, if we could challenge, a woman coming into her 50s, you're right there, she's a couple of years ahead of me. We're almost 2 years apart. What would be our charge to the woman that's 48, 49, regarding preparing oneself mentally, emotionally, physically for the decade of 50?
So I would say embrace it, like I said, as a rite of passage. Know the things that you have to do to kind of just put your body in the best health that it can be. And I'm talking from a physician's perspective, but from a mom perspective or from just a woman who's turned 50, own it. I think this is one beautiful thing that comes with this phase as we get older is we know what we want and we know what we don't want, and we can be unapologetic about it. Because I think with this age comes a little bit of clarity. I know what I don't want. I know what I always say. I'm too old now for certain shenanigans. I'm not afraid of rocking the boat, pushing the envelope. If I go somewhere and I don't think I like this, I'm out. There's no people pleasing or trying to be, you don't want to rock the boat and stuff like that. It's like, we're too old. We're past this now. So own it, embrace it, and accept that you can be clear on certain things and it's just what it is.
Trish?
Yeah. Well, the health is important because I think you could be, you're getting your weight down, you're at the gym, you're 48. You're like, okay, just know when you're 50, things start to slow down no matter what you're doing. You can go to the gym, do the same exact thing you're doing now, but the weight's not going to come back off. So start watching it now and start getting ready for your 50s and know that strength is going to change. Hair loss could happen to you. Just know that your body, you're going to wake up one morning, look in the mirror, and you're going to go,
Who is this?
What happened? What happened? What is that? Where'd that come from? And you can use your imagination on that one. But I'm like, what? But, I'd be like, girl, Trish told me to watch.
The skin tags and things that go.
You're like,
that's my thing. Like I just the way the skin like sags under the neck. That's kind of my thing. I think my challenge would be, don't wait, go and see someone in the medical field and be honest and forthright about what you're experiencing, what it feels like, what you're seeing, and really look for someone who will listen and actually treat the whole person.
Important.
I think that is my point being to you, that you said it, we think we've all said it at one point. We do not have to suffer.
Yes, you do not.
We can choose to go. And if the first person is not willing to listen, well, then go find the next person until you find, a doctor who is willing to, listen. Speaking of doctors in the room, Dr. Oni, tell them how they can learn about your DPR, direct primary care. Yes.
All right.
DPC, sorry.
Yeah. So I run a direct primary care practice here in the heart of McKinney. It's called Zelos DPC. You can check out my website, which is www.zelosdpc.com, to find more information about how you can find me. And for women who are actually suffering with menopause issues, if you feel like your doctor is not listening, you can actually go on the Menopause Society website and put your zip code in, and it'll pull up the names of a Menopause Society certified practitioner close to you.
That's very cool. I love that.
Very
Trish,
good.
tell them how they can learn about you and where to find information on you.
Well, mine's not as exciting. mine's trymarkhome.com.
Well,
if you
we
have
need
any,
homes.
Yeah, that's
we
right.
all gotta
If you have
live
any
in
issues
homes.
with your house, let me know. I'm happy to help you or give you good advice, at least, on what to do. My husband says he's the home acupuncturist, so I don't know. We'll go with that one today.
Yeah, I
if
love
you
it.
have an issue, he can help maybe solve it.
I love it. Well, I am super grateful for the two of you and for the opportunity for us to just parse through, those things that don't get talked about enough for what it's like to be a woman in the 50s. And so close us out with one important thought. If we're going to cultivate thinking that matters, what is a thought? And I think I've heard you all say it, but I'll let you repeat. So a thought we want people to cultivate to enjoy this season of life. Who wants to go first?
Well, I would say for me, it would be take care of you and don't forget yourself. Don't lose yourself in this phase. I've found, a lot of times, like you mentioned earlier, Trish, women are just everything. We're everywhere. I almost say we're like the glue that holds the home together, right? And in the process, sometimes we forget ourselves. We lose ourselves.
That's
we lose
good.
our own dreams, our own aspirations, because we're busy trying to help prop everyone else's up. But I think this is a good phase of life now where you can just confidently own who you are. So don't lose yourself.
I love it. Yeah. Trish, what about you?
I think that's it. I think enjoy each day and know that could be your last day. So just enjoy the moment. Don't let all the little things get to you.
Yeah.
And that's a lot for me because I'm a little overanalyzer sometimes. But sometimes it's just about really just enjoy. And don't be in a hurry about everything. Just appreciate what you have.
Yes, that is so true. Even just hearing you both say that, it makes me just want to take a deep breath. Oh, so good. That is so good. Well, it really does underscore why it's important to cultivate thinking that matters. Thank you both for being on the show. For the listener and also the viewer, we will continue this series. We'll drop our next one next a month or so ago. So just continue to follow for this ongoing series this year. I'm Elizabeth Mahusai, your host of Thinking That Matters. Be sure to like and subscribe. Leave us a review that helps us to get further coverage. And I will see you back here on the next episode of Thinking That Matters.